This is a simulation of an incision and drainage of the Bartholin gland abscess with the word catheter placement. I'd like to show you how I created this simulation. Taking the end of a glove, a clean glove, oatmeal and water were mixed and placed, and the area was secured off and then cut. That was then placed under the first layer of a chicken thigh. Any chicken wing, chicken breast, chicken leg, anything could be used. In addition to calf liver can be used also. All right, when performing this procedure, you should first review with the patient any risk and benefits associated with this procedure and obtain a signed informed consent. That should be placed on the chart. Then confirm any allergies that the patient has. Then place the patient in the lithotomy position. The practitioner should wash their hands and apply gloves. Good lighting is important to be able to visualize the area of the Bartholin gland abscess. Inside of the labia minora, that is where the incision should be made. So that is where the area should first be cleaned. All right, clean the area. Then I'm going to take lidocaine. This is just simulated water. Simulate lidocaine, 2 to 3 cc's. And I will inject the area around in the subacute area to numb the area before the procedure is performed. I'll pull the skin taut and then form a small wheel. Okay. As that is numbing the patient's vulva, I will make sure that the word catheter will inflate appropriately. This is done with normal saline or with tap water. It doesn't matter. The word catheter, I have a needle placed right into the underside. You can see where you place the needle. Gently push it inside of the area. And then insert the water to make sure that the bulb inflates appropriately and does not leak. Then I'll remove it, much like a Foley catheter. And actually a Foley catheter can be used to perform this if you don't have a word catheter, but a word catheter is what's recommended. All right, so I made sure that worked. So I replaced the needle inside. Now I'll ask the patient if they feel me touching, and if they don't, then I know I'm ready to perform the procedure. A 9 or 11 size blade should be obtained. And like I said, inside of the hymenal ring of the labia majora, a jabbing stab should be made. And as you can see, the contents are being dissolved. So you quickly, before the abscess runs out, you want to insert the word catheter inside, or you won't be able to. Then I'll gently remove the needle. Make sure that it won't come out, and then I tuck the underside, I tuck the other side of the word catheter inside of the vagina. This keeps it from being pulled or snagged otherwise. And this concludes the incision and drainage and insertion of a word catheter into a Bartholin gland cyst or abscess. Another way to simulate this procedure is to use iodoform packing in place of the word catheter. Believe it or not, the word catheters roughly are about $11 each. That's a huge investment for a school of nursing or for someone to just purchase to practice this procedure. You can practice going through all of the motions and use iodoform packing, much like you would pack an incision anywhere else on the body. So I'm going to demonstrate this using the same pus pocket under the skin of a chicken fryer. So we're going to pretend that I've already cleaned the area and gone through the steps of obtaining informed consent and using lidocaine to numb the area. So I'm going to start with using the blade. Once again, 9 or 11 blade is good. I'm going to, inside of the labia majora, inside the hymenal ring, very carefully pull back the labia minora. Make sure that my hands are not in the way, and I'm going to make a jabbing stab inside of the area of the Bartholin's gland. And as you can see, the pus pocket starts to drain. I'm going to take a curved hemostat and inoculate the area. Make sure, break it up really good. As you can see, that pus is really coming out. And I'm going to use iodoform packing to pack the Bartholin's gland abscess. This is a great way for students to practice, or practitioners to practice using packing. Then once the packing is in place, I'm going to cut off, and then I'm going to secure it with tape. I'll do this on the outside instead of the inside of the labia minora. And this concludes the incision and drainage of a Bartholin's abscess, packing with iodoform packing.